Hi everyone, welcome back to the channel and welcome to Emergency Room Simulator, where apparently someone had decided I'm qualified to be a doctor. A huge thank you to Aerosoft for providing me with a review key. Today, we're stepping into the emergency room, examining patients, ordering tests, making diagnosis, and hopefully giving them the right treatment. So, grab yourself a cozy drink, get comfortable, and let's see how I survive my first shift in Emergency Room Simulator. Let's go. Alrighty, here we are. Welcome to the hospital. Today is your first day as a doctor in the emergency room. Your current rank is assistant doctor, but the more emergency patients you successfully treat, the higher the rank rises, and you are assigned new patients categories. You can move WASD and tab to run. It says follow the line to room A22 because that's the shock room. Enter the room and step into the marking there. Okay, so we are on keyboard and mouse. This is room A22 and this is the marking right here. All right, so in this room, every patient is examined using the available medical equipment and the initial treatment is also performed. Take a close look at everything here and take your time to familiarize yourself with the options marked with the question mark. So this one here is a pneumatic tube system. So we put full blood containers in here from our inventory and they're sent up to get tested. So that's the first one. The next one is the blood transfusion. This is where the infusion bags with blood are stored if your patient needs blood. All right, then we've got here the stethoscope is a medical examination instrument used to listen to body sounds. You can add it to your inventory. Let's do that now. Then we've got, what's this? A disinfectant. Use the disinfectant to sanitize parts of the body, useful for preventing infection in open wounds or cuts. So let's add that as well to our inventory. Over here we've got an oxygen mask. Yes, an oxygen mask is a medical device used to deliver high concentration of oxygen. Okay, so we can also pop that one in our inventory. Over here, a defibrillator. Say that 10 times. The defibrillator is a medical device used for defibrillation, literally stopping fibrillation. The device delivers an electric current to the heart muscle via electrodes in the event of a cardiac arrest. You can then deliver the shock to the patients. Okay, then we've got the ultrasound device here. The ultrasound machine is used to perform the ultrasound examination. Ultrasound is an imaging technique based on sound waves. You can select a probe position and place the transducer on the marked area of the patient. Okay, then we've got an ECG device. That's this one. ECG stands for electrocardiogram, which is the term for the recording of an electrical activity of the heart muscle fibers. First, the electrodes must be attached to the marked location on the patient. Then you can record the ECG and subsequently view the printout. So that's that. And then over here we've got the telephone. You can use the telephone to schedule the patient for further examination and treatment in other hospital departments. Subsequently, the patient must be informed of the transfer. Alrighty, next up, what have we got here? Medications. Pretty self-explanatory. Medications. Here's where you find the medication, oral. There are oral medications that the patient has to swallow or IV medications, which are intravenous medications, which first need to be combined with an empty syringe or infusion bag and then can be administered to the patient. Okay. Then we've got punctures. The puncture needle used to perform a puncture is located here. In an emergency, get the puncture needle from the drawer and puncture the patient at the marked spot. Okay, so that's punctures. Then we've got syringes. And these syringes here, we'll find syringes for combining and injecting IV medication as well as laboratory tubes for blood collection. So that's in this drawer here. And what else do we have? We have, what's this? Infusions. Look at that. Different types of infusions. IV fluids. Here you will find the infusions you can administer to the patient as needed. Okay. As well as empty infusion bags that can be combined with IV medication. Okay, so that's that one. And then up here is needle and thread. What do we have here? Needle and thread. Here you'll find needle and thread which are needed to sew up wounds and cuts. Okay, now you'll get to know your tablet, which is absolutely essential for your work here. The four main sections from left to right are patient, file, test results, archive, and profile. Open the tablet with tab, pre-examination, diagnosis, treatment, and emergency. Okay, switch through to the categories using Y or 1. We've got patient, blood work, archives, and profile. That's test results there. Patient file. Okay, for example, current. Close the tablet. All right, let's close the tablet. Now you have gained a first overview here in the shock room. However, you will also need to use radiology for your examinations. This is located directly opposite the shock room in room A25. Leave the shock room now and go to the marking in the hallway in room A26. Okay, better open the door. In front of the room A26 is the X-ray machine. An X-ray examination is performed with the X-ray machine. If you need to do such an examination later, please place the stretcher with the patient in the marked area and undress the patient. Okay. Now go back into the hallway and go to room A24. Here. Okay. Let's open that up. Because that's where the CT scanner is, and it's called a CT for short. A computed tomograph CT scanner is a medical device used to perform a computed tomograph scan. If you need to do such an examination later, place the stretcher with the patient in the marked area and undress your patient. Between the two rooms is room A24. So this is the control room for in the radiology control room. You perform and monitor the examination of the X-ray machine and the computed tomograph scanner. Familiarize yourself. You can trigger the X-ray on this computer as long as the patient is undressed in the stretcher and is placed in the marked area. You can then view the results of the X-ray directly on the tablet. And the CT, you can start the CT on the computer as long as the patient is undressed in the stretcher and placed in the marked area. Once you have looked around and have enough, go back to the shock room. So this is heading into another hallway. So we'll just close. Well, we don't need to close that, I don't think, but we can close that one, certainly. And then this will go back. And we can go to the shock room. New patient in the entrance. Attention, an emergency. Run to the entrance and speak to the paramedic. Quick. Hurry. Okay, select briefing on the physical examination. Briefing. Right, the patient has a wound on its left lower leg. Select vital parameters checked by the paramedics to obtain information about the patient. Vital parameters. The vital parameters are still within the normal range, only the blood pressure is somewhat low and pulse is slightly something or other. Select brief patient brief anamnesis. We were called to an injury on the leg. We were already able to stop it. Okay. And then transfer the patient to the shock room. Now let's, what's that noise? Okay, push the stretcher using WASD and follow the line to the shock room. Come on, now quickly into the shock room. Hurry, place the stretcher with the patient at the marked area with the left mouse button. Is that right mouse button? All right, there we are. Now, the pre-examination is being carried out. Select the patient interaction, right? Now select interview the patient. Interview. Ask the patient all 7 questions. Breath-dependent pain? No, I do not. We've got, well, I'm a little worried. It might get infected. Family? No, I don't. I know nothing about heart disease. Pain, radiation? No, the pain is only localized to the area of the wound. No, I was not bedridden. I was completely mobile. Recently, physical trauma. Yes, I had a accident and sustained a cut to my leg and thrombosis and embolism. No, I wouldn't know that I had a thrombosis or embolism. Right, now it does say open the tablet and select the pre-examination category, which we have on the right, and you can see the patient's answers over here. So, family not known. Pain, radiation, pain, no pain. No pain, radiation. Bedridden, no bedridden. No bedridden. Physical trauma, accident. Accident. Thrombosis, no. No thrombosis. Breath-dependent pain, no. Excited/fear. Concern, not fear of death. Concern, not fear of death. Okay. Select pre-examination to conclude. On the right, you can see that the patient's answered. All right, that's all done. Now, open the diagnosis section on the tablet. Right, now here you can see all the possible diagnoses and fit the pre-examination. Diagnoses need to be backed up in order to be sure what disease the patient has. To find evidence, you have to carry out examinations. Now, choose the diagnosis, cut, and try to prove it with further tests. Okay, so we've proved it with these three, and now we need a visual inspection here. So let's press tab. Let's go to, hold this one and select patient then storage and preparation. Then we want to undress the patient. Yes, and then select approximate 10 centimeter cut. So over here, we can select that. Now open the tablet, a cut of 10 centimeters on the lower leg. Cut on the lower leg. Now you can finish the diagnosis. Right. Okay, diagnosis determined. Let's select treatment, close the tab. The patient needs a painkiller of ibuprofen tablets. Get it from the cabinet. Okay. Let's get some medicine. Ibuprofen. If you have in the inventory, you can select them. Right, let's give some medication. Yeah, take these tablets and it'll make you feel better. All right, let's press the tab under treatment, administer painkiller and administer anesthetics. Okay, so it's got taken ampule of anesthetic out of the cabinet, take a syringe and combine them. Okay, and then inject. So let's do that. Let me press space. The substeps show that what you can do includes the tablet. Okay, so we need a syringe. Let's just close that for a minute. We need to grab a syringe. Yep. And then we need to grab an anesthetic. Anesthetic, here we are. Now we need to combine the two. Syringe and infusion bags need to be combined in IV medication first. If you have an empty syringe in the infusion bag, IV in your inventory, click I, then click C. C for combined. There we are. Now go to the patient and select patient interaction. Administer medication, and finally inject. Here we are. There we go. Now, new treatment steps are required. Open the tablet. Let's do that. And we need to disinfect the wound. We need to close the wound, and then we need to put on a bandage. So we've got this for disinfectant. Disinfect the wound. Now carry out the treatment. Close the wound. Let's see. We need the needle and thread. And then we might need a bandage as well. Okay. So back to the wound. Close the wound. Okay. It's quite serious, the cut you have here. How did you cut yourself? Oh, I fell down. Well, that's not good. Alrighty. Now we need to place a bandage. There we are. Just gonna bandage it up. There we go. Perfect. Now, that is all done. Administer a tetanus vaccine and register the patient for aftercare. So do we need another syringe? Maybe we do. Oh, there was two. Okay, let's close that one. And we need a tetanus. Let's have a look. Tetanus. Morphine, paracetamol, tetanus. Inventory. Select. Inventory. See. Alright, that's combined. Now we need to administer it over here. Oh. Administer medication. Injection. I'm going to give you an injection. Don't worry, you'll feel better quickly. It's just a prick. Now go to the phone and register the patient for aftercare. Okay, go to the phone. And aftercare. Intervention, cardiac, bladder, dialysis, registration, aftercare. There we are. Now go to the patient and select the interaction, bringing the patient to us when the treatment is ready. All right. Now inform the patient of being transferred. So transfer the patient to aftercare. Now everything is now prepared. They can take you to aftercare. Storage. Let's dress the patient again. Every patient must be brought into the elevator. At the entrance at the end, there's a colleague from another department is already waiting to take over. Okay, so we need to come over here. We need to... That's it. Oh. Alrighty, here we go. Just rotate. Every patient must be brought into the elevator. Alrighty. Looks like patient number 2 was saved. Oh. Yeah, coming. I'm coming. There we go. Take care of her. Now your colleague is taking over. Treatment completed. Beautiful. Complete the treatment on the tablet. Treatment concluded. There we go. Not bad for the first one. 421 out of 500. Congratulations. Your first treatment of the emergency patient has been successful. Go back to the shock room. You certainly won't have any peace for very long because the next emergency is sure to come. All right, back to the shock room. It's very shocking. Oh, a new patient. We better go. Coming. Dr. Tanya here. How can I help? Okay, the patient had internal injuries or abnormalities. All right, what else? We notice arrhythmias in ECG and measured elevated blood pressure. What else? We were called due to headaches and dizziness. The patient reports feeling tired and weak. All right, let's transfer you to the shock room. All right, might have to do an ECG on you. So we've got the patient up there. Stephen, welcome. Welcome to the hospital. Don't you worry. I will take good care of you. That's right. Look, I'm just an assistant at this point in time, but I should hopefully become a full-blown doctor anytime soon. Alrighty, so there we go. Now, interview the patient. Okay, let's ask a series of questions. Nothing to do with my breath. Excited fear. Well, it is, of course, very worrying. Okay, what about your family? My grandmother had heart problems. That's not good. I don't actually have any pain, just dizzy and weakness. I have been in bed a lot lately because I constantly feel tired and groggy. Actually, no. And no, I have never experienced anything like this before. Okay, so that's the first interview. Here we go. We've got patient. Cancer, no cancer. No heart, no cancer, heart disease. No heart disease? No cancer, heart disease, right? We've got pain radiation, no pain. We've got bedridden. Yes, bedridden. Yes, due to fatigue. Recent physical trauma. No physical trauma. Thrombosis is a negative. No. Chest pain. Not dependent on breathing. Okay. And we've also got an excited fear concern. Not fear of death. All right. So that is done. Looks like we've just gone over the next level. So let's see what we have here. That's all done. It could be kidney failure, slowed heart rate, electrolyte disorder, or stroke. So what do we think? Kidney, we've got 4 ticked. Slowed heart rate, we've got 3. Electrolyte disorder is 3. And a stroke is 3. At this point, let's try kidney failure. Okay, we've got a visual inspection. So we need to undress the patient and look at the body. And then we've got an escalation of the heart. Pick up the stethoscope and escalate. Okay, so first things first, we're just going to undress you. Alrighty. Now, we're going to look at the patient. No abnormalities. Beautiful. Now we're going to use our stethoscope. And we're going to check your heart rate. Sounds normal. At least the lung is uninjured. Yeah. One clearly recognizes a slowed heartbeat. What about this one? You need to do a poops? Maybe. Stomach sounds normal. Oh, that's good. So, undress the patient. So now we can go back in here. Diagnosis. Visual inspection. No abnormalities. This one here. Change slowed heart rate. And auscultation. No moist, rattling, wheezing, no normal findings. And what else do we do? Cardiac ultrasound is what we need. Blood test electrolyte, and CT for the chest. So we still have a few more things to do. We've got a cardiac ultrasound. So undress and perform a cardiac ultrasound. Okay. Now, Stephen, we're just going to perform a cardiac ultrasound on your heart. Okay. What does that mean? Ask the patient about pain radiation. Everything looks fine. Why don't we have a look over here? Nothing? Right, an ECG. Entry. Right heart fluid enlarged. Noticeable. Didn't really tell me, did it? Let's try it again. Let's see. Perform a cardiac ultrasound examination. Okay. Cardiac. Kidney. Lung. Unless it's this one. Place electrodes. I can view the ECG recording on the paper printout on my tablet. I think we need to show printout. Back. Record. Remove. Show printout. One clear, slow heartbeat. Okay. Perform the ultrasound. Now we do need to remove. Yes, we do. There we go. Nice. Now, we need to perform the ultrasound. Cardiac ultrasound examination. No anomalies. Everything looks good. Oh. Cardiac ultrasound examination. Alrighty. So hopefully that did something. Now, cardiac ultrasound. No abnormalities. It still tells me to perform. Kidney failure. Blood test for creatine. Okay, pick up the blood container. I think maybe I selected the wrong thing. So let's pick up the blood container. Oh, is it from over here? Send blood over here. Blood container, yes. And take blood. Yes. Fill the blood container, yes. There we go. We are now taking blood. And send the blood to the laboratory. There we go. And there it went. The results for the blood test will certainly be sent to the lab on the tablet. Okay. So we've done the lab on the tablet. So let's have a look, see. Oh, here they are. All blood values are within normal range, so that's good. So, pain, blood test, creatine. Let's check the creatine is within normal range. Yes. Blood test electrolytes. Let's have a look. We'll say within normal range. And CT chest. So, next step, blood test electrolytes. Pick up the blood. We've got to do 2 tests. Okay. Oh, here we go. Fill the blood container. Take the blood. And let's pop it over here. Test the electrolytes. All right, now let's check this blood test. Feels tired, does not take any medication, and nausea. So, diagnosis for electrolytes. Now, transfer the patient to CT and perform the CT scan. All right, we are just about to send you to get a CT, but first we'll just pop your clothes back on and we will certainly get you ready for this CT scanner. Oh. There we are. Oh. Okay, so the CT is that one over there, I think. Yep, this one here is the CT. So let's deliver the patient. Okay, now we need to undress the patient and perform the CT. Okay, over here. Better close the door. Can we close this one as well? Yes, brilliant. And we'll just close this one as well. Now, patient's just there. And we need to perform a CT on the thorax. Oh, here we go. View the CT results on the tablet. Here we go. The thorax, I believe, is in the throat. Now, it should take a closer look at the CT image on the tablet. Okay. CT test results, no abnormalities. Okay. So go back here. Diagnosis to conclude. In normal range and no abnormalities. There we go. Now, CT is no abnormalities. Diagnosis to conclude. Alrighty, so that's all done. Now we've got a slowed heart rate. Undress the patient, pick up the stethoscope. We have done that. Write the ECG. Slowed heart rate, so we can say that. Now the blood test D-dimmer. Let's have a quick look at that. D-dimmer is within range. So D-dimmer in normal range. And the troponin blood test, let's have a quick look at that, is within range. Normal range, in normal range. Okay, so that's also what we can diagnose. What else do we have? Treatment. Now, administer adrenaline and register the patient for intensive care. Okay, so let's go back to the patient. All right, sir, let me just pop your your clothes back on, and we need to just take you back here. That's right. There we go. And we may need to administer some adrenaline. So we'll definitely need a syringe. And we'll need some medication. All right, so we do have adrenaline. I believe I've seen it. Here we go. That's the first one. So we need to press I. We need to press C, almost to combine it. There we go. And we need to administer it to the patient. There we go. Here we go. I'm going to give you an injection, but don't worry. You'll feel better in no time. Okay. Now, select registration intervention on the phone. Okay, let's do that. Registration intervention on the phone. Yes. Inform the patient about the transfer to intensive care and bring the patient to us, and we will prepare everything from here. All right, not a problem. Look, Stephen, thank you so much. You've been an absolute delightful patient. But I have organised some intensive care for you. I have just given you some adrenaline. We are not too sure what the issue is. We've done an ECG. We've done a CT scan. We've taken blood. Yeah? Oh, I haven't informed you. Sorry. I better inform you. There we are. Back to the stretcher. Yes. Everything is now prepared and we'll transfer you for further treatment. So, I have given you just a little bit of adrenaline, but don't worry. That'll kick in very quickly and they'll look after you upstairs. All right, Stephen, all the best, okay? All the best. Have a nice nap. Alrighty. Treatment complete. Now, let me conclude the treatment. Done. Done, done, and done. So he had the complaint that he was feeling nausea and tired. Fantastic. Alrighty. New patient. Alrighty, well, we might just leave it there. Thank you so much for watching. Be sure to smash that subscribe button, like and comment, and let me know if this game is something you would enjoy in a series. Thanks everyone for watching. I'll see you in the next one. Bye for now.